we try to bring in a kind of a solution which can help us overcome all this problem, where we are able to provide expert assistance like an ICU within 10 to 15 minutes of a call. We have developed an app, and this app is designed to get dispatched within 2 minutes from the time the call comes in. And this two-wheeler is driven by ICU trained paramedic people, and they have the entire gadgets that is available on a two-wheeler. And it is a kind of a mini ICU that can be transported on a two-wheeler to reach the site of medical emergency within 10 minutes.
Hello friends, good evening to all of you. Pradeep sir, how are you?
Very fine.
A very special session today about the startup. Welcome once again. So I invite Dr. Pradeep Kumar. Today is a very special evening. Today I am very privileged to have, we all are very happy that Dr. Pradeep has spared his time out of his busy schedule, and he is going to talk with us. He is not only the director and chief of the Brooklyn Hospital in Bangalore, but he is also a very good long experience of working in Gujarat also. And we had a very nice chat in the Hall of Fame interview one of these days. And you can go to the Hall of Fame interviews and listen to him about the success story. Today we are going to discuss a different aspect, that he has successfully managed to launch and run startup along with his practice. That is what we are going to hear from him. And we will just give the Dr. Pradeep the stage. Yes, Dr. Pradeep, carry on. Stage is yours.
Thanks to Dr. Pranav and Dr. Amit for giving me this opportunity to talk to you about one of the innovations that we have developed at Brookfield Hospital. So I will take you through why we did this, how we did this in the next few minutes. This is only to emphasize that we as treating physicians and clinicians know the pulse of the people. We know the working at the grassroots level. We know what's the actual pain points that are there. So this is an humble attempt to treat one such challenges that we come across in our clinical practice on treating the golden hour during a medical emergencies. So I will take you through on why, what, and how this whole thing started off with. So I'll just introduce you to this concept called as BEAST. So I was mentioning about what is BEAST. BEAST stands for Brookfield Emergency and Accident Support Team. That's a full form of BEAST. We all know that medical emergencies can happen to anyone, anywhere, anytime. And how we visualize BEAST is as a life-saving support system to ensure that we provide an end-to-end support during. This is a two-wheeler mobile application-based system that can provide on-site ICU-like medical services during any medical emergencies. It can be at home or at office or on the road. What does BEAST actually do and how does it work? It is a combination of technology using man, medicine, medical equipments, medicines, and technology. I call it as a 4M and 1T: man, medicines, medical equipments, and technology. So this particular technology that we're talking about utilizes this technology, ensuring that we are able to reach a site of medical emergency in the fastest possible time, reach fast, diagnose fast, treat fast, and stabilize fast, and then subsequently shift the patient to a hospital of their choice by means of a conventional ambulance. Thereby, we are able to use every second of this golden hour. Thereby, we are able to save those precious lives. So that's exactly what we wanted to do whenever we started talking about what this BEAST is. Now, we understood that me sitting bang on the main road, when I was receiving patients being brought there to the hospital, that was very disturbing. We have the best of the facilities, is being brought dead. We can't do anything much about it, right? So that is the reason why we said there is something that is going wrong, and let's see what is it that is there. And then we went at the problem, reviewed literature, and then we reviewed what is actually happening in the ground reality. Found that 80% of the people make it to the hospital during the golden hour. And out of those people who reach, 30% of these emergency cases result in death because of delay or arrival to the hospital. Now, this golden hour during a medical emergency is extremely crucial. And what happens during most of this time is that there is a whole lot of confusion. There is a whole lot of panic that is occurring during the medical emergency by the patient's attenders. They tend to call multiple numbers. don't know whom to call to. Some people may call neighbors, some people may call hospitals, some people may call emergency helpline numbers, some people may call ambulances, and none of these are all coordinated actions. And by the time the ambulance arrives, by the time the patient arrives in the hospital, it is quite late. Now, we know how the run ambulances. We've been talking about the 108s that are available. Most often, these 108s are usually overloaded. 28% of the calls are declined. And what they do is they usually take the patients, and we know the whole lot of kickbacks that are available between excess that occurs between the ambulance drivers, the paramedics, and the hospitals and other things. So these private ambulances do not meet the standards that are required to make sure that we have the required ALS systems that needs to be there. And most often, the ambulances are very close to the hospitals and not spread throughout this. And we always come to a situation where the mismatch between demand side and the action where it is required. Now, because of all these things, now we understood what are the challenges that are there. I have listed these challenges in a conventional sequence that occurs during a medical emergency. What happens during the patient side? What happens at the hospital side? What happens in the ambulance and reaching the patient side? At the patient's bedside, what are the complications that we expect? And then what happens when a patient comes to the hospital? So what we try to do is we try to bring in a kind of a solution which can help us overcome all this problem, where we are able to provide expert assistance like an ICU within 10 to 15 minutes of a call. We have developed an app, and this app is designed to get dispatched within 2 minutes from the time the call comes in. And this two-wheeler is driven by ICU trained paramedic people, and they have the entire gadgets that is available on a two-wheeler. And it is a kind of a mini ICU that can be transported on a two-wheeler to reach the site of medical emergency within 10 minutes. So this is brief about how this particular product is. A person gets registered, and on registration, their entire medical history is collected on cloud. There is emergency contacts that are mapped to each of these candidates who are registered. There are experts who are there on the video call. Whenever there is a medical emergency, an SOS button is pressed. The vehicles are located through the GPS. The closest vehicle to the place where the call comes in from is dispatched within 2 minutes. And this ICU-like care is delivered to the patients within 10 minutes. And post that treatment, if the treatment needs to be continued further, chosen two-wheelers so that we easy parking facility, this advanced medical equipments, the monitor that is available, this sends live feeds to the ICUs from the patient site to the hospital. This can get connected to anyone across the globe. And if any one of their family members want to actually view on what's happening, we can give them access to this. And that's how the entire family members who are there across the globe can also participate in this particular active treatment process that is there. So we have designed this to make sure that we are able to treat any medical emergencies. It could be simplest of emergencies like endocrine emergencies like hypoglycemia, high sugars. It can be acute cardiac emergencies like an acute MI. It can be road traffic accidents. It can be gunshot injuries. It can be poisonings. It can be suicidal attacks. And these are all the various kind of cases that we have dealt with whenever we have identified this particular procedures that we have identified. Now, what we did was, this has been pioneered by Brookfield Hospital for close to almost around 4 years right now. And we tried to understand how effective has been this BEAST system by treating these medical emergencies. We also wanted to understand what is the demographic and clinical profile of the patients that were there. And then we also wanted to understand what is the survival rates of these patients whenever we have understood these patients. So we've been doing the study over the last 4 years right now. And then we try to understand and present this kind of a data to each one of you to see what we have done over the last 4 years. So as I mentioned to you, the primary objective of BEAST was to ensure that we provide a rapid and effective emergency system. And whenever there's a medical emergency, we have to ensure that we use every second of this golden hour in the most effective manner. The aim is to reduce the mortality, reach out to the hospital at the fastest, to ensure that we provide the best medical treatment that can be given, and thereby increase the chances of survival for these patients. And the entire process is patient-centric, and everywhere we try to focus on ensuring that the best treatment could be given to the patients during these medical emergencies. So this is what we did. This is a sample of the vehicle that we have. These are all the medical equipments that are part of this particular vehicle that we have. So that's how we designed this entire process. And then we tried to see how this particular patient-centric solution can help us to overcome a given situation that is available in the current challenges. It is a team of two trained paramedic people who are trained in the ICU, and they respond to this SOS by ensuring they reach out to the patient in the shortest possible time. I'll take you down through these statistics in a short way on how many people have been able to download the app, how many people have been able to use these facilities, what is the kind of a male and female distribution of these patients, and what happened to these cases which were not attended because of medical emergencies. How many of those cases were treated according to the departments that were there, a year-wise distribution? You can see the kind of cases that we're talking about: cardiac cases, pulmonary cases, gastro cases, neuro cases, suicidal and poisoning cases, acute surgical cases, diabetic, COVID, palliative accidents. These are the distribution of the cases that we have dealt with. And because of the current system that we had 5 such vehicles that were located, and these 5 vehicles were there in and around our hospital. And most of these patients, because of the paucity of funds that were available, we tried to locate these ambulances very close to the hospital premises, our own hospital premises. And that is why we were able to transfer these patients to our hospital whenever we were not able to service them to its fullest extent. The kind of cases that were transferred to nearby hospitals were also the partnered hospitals that were close by to our hospital. We transferred few of those cases to those places also. Now, not everything was hunky-dory. We did lose a few cases who succumbed because of severe emergencies. Some of the cases whom we lost were some cardiac cases. Some of them were ARDS cases. A lot of them were during the COVID time that we lost severe patients because of acute respiratory distress syndrome. These were the patients, and some of the patients whom we lost were due to accidents. Now, this is a summary of the kind of cases that we have dealt with. In the cardiac cases, we have dealt with acute myocardial infarctions, cardiac arrests, congestive heart failure, cardiac arrhythmias. In the pulmonary cases, we have dealt with acute respiratory diseases, pneumothorax, severe asthmatic attacks, hemoptysis. In the gastrointestinal disorders, we dealt with GI bleeding, acute pancreatitis, bowel obstruction, perforated peptic ulcers. In the neurological cases, we have dealt with stroke, seizures, intracranial hemorrhage, acute severe migraine. What I want to impress upon you all is you can see the variety of cases that we have actually been able to treat with during these medical emergencies using this particular system that we were having. Now, some of them were poisoning cases like drug overdosing, home cleaning solutions, rat poisoning, OP poisonings. Diabetic emergencies, we had our hospital deals with a whole lot of diabetic patients. So there were a significant amount of hypoglycemic patients presented to it with unresponsiveness and coma, and we were able to treat them with just ensuring that the blood sugars were diagnosed, treated, and immediate treatment was initiated. We had a few malignancies like lung cancers, esophageal cancers. These were the other cases that we also dealt with. The surgical cases were acute appendicitis, cholecystitis, hollow viscous perforations, and a whole lot of COVID cases that were talked about, which presented to us as an acute ILI, severe respiratory distress, road traffic accidents, head injuries, polytraumas, long trauma fractures, crush injuries, facial bone fractures. Now, these were all the kind of cases that we could deal with whenever we saw them. Now, I wanted to impress upon you, there were quite a few calls that we could not receive, and those were because of the various other challenges. Now, how did Beast make a difference to all these patients? What we did was we said that instead of the patient coming down to the hospital and the various challenges that we have, let us go to the patient site through a two-wheeler, through the super trained ERT people, and we will ensure that we are there within the patient's location by within 15 minutes. And that's how this whole device came into existence, and tried to give a solution to patients who were going through these emergencies. And that is exactly what we achieved by making sure that Beast becomes a viable solution. So why I wanted to present this to our audience here is that whenever we come with challenges, we need to try and identify how these challenges can be treated as opportunities. And that's how we at Brookfield Hospital try to use this challenge and come out with a solution, and this has given us a golden opportunity. opportunity. Now, this particular beast is an opportunity that is available for most of our friends and colleagues here, where we can probably collaborate and try and see if we can replicate this across the country. And that's when I spoke to Dr. Pranav and Amit about how we could collaborate amongst our doctors at the Doctors Entrepreneurs Academy. He said, why don't you present this and let's see what we can do to collectively together. And our aim is to see how we can you provide this as a national emergency program and become the first responder program for the patients across the country. So, dear friends, in brief, this BEAST is a project which we call as the Brookfield Emergency and Accident Support Team. Today, this B is standing for Brookfield. Tomorrow, this B can be Bangalore, and day after tomorrow, it can be Bharat. And that's what we want this BEAST to be, a national emergency program. And this is designed to provide immediate medical support in medical emergencies. And the main aim is to reach fast, diagnose fast, treat fast, stabilize fast, and then transfer to the nearest appropriate hospital if necessary through a conventional ambulances. Now, whenever there are medical emergencies, we know that because of lack of coordinated effort from the entire medical ecosystem, there will be delay in these people reaching the hospital. There will be limited availability of specialized, well-equipped ambulances. And we need to make sure that all these challenges are overcome by one compact solution. And that is what we have tried to provide by using this beast as a solution. In the current scenario, the outcome of the treatment can be negatively impacted due to these challenges. And what we need to understand is this is highly skillful, it is highly risky proposition, but someone has to bite the bullet. And we have taken the initiative to pioneer this and see how we can provide this. With God's grace, with the help of the medical fraternity, we hope that it is able to be a kind of a program which can be an effective solution to treat medical emergencies whenever an opportunity comes in. So that's in just about what this beast is. We'll stop the presentation here.
Fantastic presentation, sir. Despite all the odds, despite all the technical stuff, you have been always a good speaker. And you showed here that if you have thought in a process in a mind, then the clarity is there and the clarity of thought will take you to the new destination. Very, very good presentation, sir.